Hello everyone, I'm Dr. Pearl Zimmerman, sharing today about unexpected everyday daggers that sabotage health. Why are food allergies on the rise? What exactly happens if people keep eating foods that they're allergic to? And how should people determine if they need to stop eating gluten too? Conventional food allergy testing usually only includes skin scratch testing and or blood testing for IgE allergies. IgE allergy testing only picks up foods that cause an immediately dangerous response, such as a peanut allergy that can cause you to stop breathing. Unfortunately, IgE allergy testing can be inaccurate. If you have environmental allergies, for example, to pollens or molds that can cause your immune system to overreact and give false positive results, meaning that many foods come back positive for allergies when in fact you aren't really allergic to those positive foods. Gluten is a hot topic in functional and integrative medicine because leaky gut can develop whenever you have emotional or physical injuries, infections, chemical or mold toxicities. Even one single episode of food poisoning can develop into a chronic infection that destroys your intestinal lining. As your intestinal lining allows larger particles of food to get into the bloodstream, your immune system attacks those foods and you develop allergies to them. Sadly, gluten and dairy tend to be the first foods that you lose. To complicate things further, gluten does not act like any other normal food. Immunologists have found that gluten triggers an immune response that lasts 15 to 20 months. This is why you may not notice any immediate negative effects from eating gluten, while it can be insidiously doing damage to your body on a chronic basis for over a year after every time you eat gluten. Once gluten leaks into your bloodstream, it tends to attach to your thyroid, gastrointestinal, or brain tissue. As your immune system attacks gluten, it then also attacks your own body tissue wherever gluten has attached. And this is exactly how autoimmune diseases develop. The immune system also starts to attack foods that have a similar chemical structure to gluten, called gluten cross-reactive foods. So I recommend specialized functional medicine testing looking for intolerances to both gluten as well as these gluten cross-reactive foods. When my patients don't improve after removing gluten, I know that it's often because they didn't know that they also had intolerances to those gluten-like foods. Dairy is the most common allergy found amongst the gluten cross-reactive foods. To go deeper regarding how food allergies impact your energy and chronic wellness issues, register for my free video series on conquering fatigue. Simply click the link next to this video. To your health, this is Dr. Pearl Zimmerman, and thank you so much for watching today.